lady from Botswana had come to us with a scar on her left leg, which was there since a long time when she had a trauma to her left leg about 20 years back. So this traumatic scar was actually stuck to the bone and was causing contoural abnormalities. A staged surgery in which the first stage we removed the scar which was stuck to the bone, and in the second stage we performed something called as a fat grafting procedure. So fat grafting is a novel technique for improving the contour in certain areas of the body, in which we remove fat or we extract fat from certain areas like the abdomen or the thighs. This fat is then centrifuged and then it is injected into the areas where there is a depressed scar or contour abnormalities. In addition to the fat grafting, we also used growth factor concentrate or GFC as it is commonly called to enhance vitality or the viability of the fat. So this was a novel case. She is quite happy with the results.